Now, to a looming crisis in Kenya's vaccination program following a growing supply problem in the world. Citizen TV has learned that the Ministry of Health is considering slowing down the vaccination process should India continue with its freeze on vaccine exports. But as Dorcas Wangira now reports, the ministry remains optimistic about the second shipment at the end of the month, but is also looking at alternative supplies.
Concern over the future supplies of COVID-19 vaccines has been mounting since India put a freeze on vaccine exports following a surge in its COVID-19 infections. The Serum Institute of India, unable to meet the rising domestic demand, combined with its global obligations under the COVAX arrangement. Sources in the Ministry of Health told Citizen TV that Kenya may be forced to stop or slow down the ongoing vaccination program if supply constraint in India persists. With an accelerated rate of 30,000 to 40,000 jabs a day, the current vaccine stocks could only last a few days, putting the government between a rock and a hard place since the first recipients of the jab will already be due for the second shot. The situation complicated by the uncertainty around the possibility of having the second shot from a different vaccine. The WHO's Regulation Director, Rogério Gaspar, maintaining that there is no data available at the moment to support a mix and match approach. But the head of the Vaccine Task Force, Dr. Willis Ahwale, says the government remains hopeful that the next consignment of 2.5 million doses will indeed arrive on May 2nd as anticipated. According to the latest government data, 8th April, 455,826 people have been vaccinated, with 455,299 having received the AstraZeneca vaccine and 527 the Sputnik V vaccine. Of the 1.12 million doses received, 999,000 have been distributed to the regional depots and 121,000 are in the National Central Vaccine Store in Kitengela. Nairobi still leads in the vaccination, accounting for 32% of all people vaccinated. Other leading counties are Nakuru, Uasin Gishu, Kiambu and Nyeri. Lamu County has the least uptake, recording less than 500 people having been vaccinated at 0.1%. Kwale, Mandera, Tana River and Marsabit have also recorded low uptake. At the regional depots, less than 300,000 doses remain, with Nairobi having the highest quantity and the Meru store having the least. Kenya, however, is already considering securing vaccines outside the COVID-19 Vaccines Global Access Facility, COVAX, an option the WHO chief Dr. Tedros Adhanom Ghebreyesus has warned could increase vaccine inequity if more countries bypass COVAX.
The problem is not getting vaccines out of COVAX. The problem is getting them in. We understand that some countries and companies plan to do their own bilateral vaccine donations, bypassing COVAX for their own political or commercial reasons. These bilateral arrangements run the risk of fanning the flames of vaccine inequity. This is a time for partnership, not patronage. Scarcity of supply is driving vaccine nationalism and vaccine diplomacy.
Globally, the WHO says there is what it calls a shocking imbalance in the distribution of COVID-19 vaccines, and most countries do not have anywhere near enough shots to cover health workers and others at high risk. More than 700 million jabs have been administered worldwide against the disease, but 87% have gone to high-income or upper-middle-income countries, with low-income countries receiving just 0.2%. On average, in high-income countries, almost 1 in 4 people has received a COVID-19 vaccine. In low-income countries, it's 1 in more than 500. The COVAX program has delivered nearly 38.4 million doses of COVID-19 vaccines to 102 countries across 6 continents, 6 weeks after it began to roll out supplies. It aims to deliver more than 2 billion doses this year, but has faced delays.
In the second half of the year, we will see more suppliers come online, and we'll be able to benefit from expanded production capacity at manufacturers that already are supplying to us. But again, it's critical that we have solidarity and work, because what we're now beginning to see are supply constraints, not just of vaccines, but also of the goods that go into making vaccines.
In the last 24 hours, 1,030 people have tested positive for COVID-19, bringing Kenya's caseload to 145,184. The test positivity rate being 12.4% from a sample size of 8,316. 21 deaths have been recorded, 5 having occurred in the last 1 month, and 16 being late deaths which occurred on diverse dates. 1,616 patients are admitted in various health facilities, with 247 being admitted in the ICU. Dorcas Wangira, Citizen TV, Nairobi.